fever, cough, shortness of breath, increased susceptibility to respiratory viral infections, e.g. adenovirus, parainfluenza, and respiratory syncytial virus, and 2. Opportunistic infections, e.g. pneumocystis carinii, fever, diarrhea, vomiting, increased susceptibility to viral gastroenteritis, rotavirus, cough, shortness of breath, cyanosis, increased incidence of congenital heart defect, tetralogy of Fallot, truncus arteriosus, interrupted aortic arch, seizures, hypocalcemic, feeding difficulties, increased incidence of palatal abnormalities, congenital heart defect, failure to thrive characteristic facies, hypertelorism, low-set simple ears, micrognathia, short upper lip philtrum, cyanosis, heart murmur, congenital heart defect, palatal abnormalities, cleft palate, velopharyngeal insufficiency, hypernasal, speech, nasal regurgitation, feeding difficulties, nonverbal learning disability, culture infection sites, tracheal aspirates, stool cultures, complete blood count, with differential and platelet count, endocrine evaluation, low calcium, elevated phosphorus, absent to low, parathyroid hormone, cardiology evaluation, chest radiograph, invisible thymus, cardiomegaly, conotruncal abnormalities, electrocardiogram, echocardiogram, cell-mediated immunodeficiency, low absolute lymphocyte count, diminished total T-cell numbers, abnormal T-cell proliferation in vitro, mitogens and/or antigens, small proportion have markedly impaired T-cell function, humoral immunodeficiency occasionally, hypergammaglobulinemia, rare, hypogammaglobulinemia, immunoglobulin A, IgA deficiency delayed, development of responsiveness to protein antigens, e.g. tetanus and diphtheria, titers, normal immunologic functions, complement system, phagocytes, neutrophils, monocytes, macrophages, eosinophils, cardiac mortality and morbidity, infections, seizures, increased risk for autoimmune disease, differential diagnosis, cell-mediated immunodeficiency, severe combined immunodeficiency, interleukin-2 receptor deficiency, abnormal signal transduction, adenosine, deaminase deficiency, purine nucleoside, phosphorylase deficiency,
Bare lymfocyte syndrome,
Wiskett-Aldrich syndrome, ataxia telangiectasia, cartilage hair hypoplasia, HIV infection, congenital heart defect without immunodeficiency, or other possible components, a field defect treatment, diet and lifestyle, until presence and severity of immunodeficiency are defined, carry out isolation precautions and administer only irradiated, cytomegalovirus negative blood products. Among those with immunodeficiency, most have mild defect, which will normalize by 1 year of age. Therefore, a normal lifestyle is recommended for most children. Pharmacologic treatment, Bactrim, for pneumocystis carinii, pneumonia prophylaxis in those with severe immunodeficiency, varicella zoster immune globulin, consider for chickenpox exposure and acyclovir chickenpox infection. Other treatment options, thymic or bone marrow transplant, for severe cases of immunodeficiency, intravenous gamma globulin. Treatment aims to repair cardiac defect, to aggressively manage infections, to correct calcium abnormalities, to correct cleft palate, to conduct speech and language therapy, to carefully document immunodeficiency, and reassess degree of cell-mediated and humoral abnormalities,